This cow was suffering from a giant wart-like tumor located near the udder region. Over time, the mass continued increasing in size, causing discomfort during walking, sitting, and even milking. Because of continuous friction and trauma, the risks of bleeding, infection, and tissue damage also become very high. Large abnormal growth like this should never be ignored because they may interfere with normal movement and overall health of the animal. In today's video, we will demonstrate the complete surgical removal of the giant tumor step by step. This type of abnormal growth may develop as a wart, papilloma, fibroma, or other tumor-like tissue proliferation. In cattle, such growth are commonly associated with papillomavirus infection, chronic skin irritation, repeated trauma, or untreated skin lesion. Initially, the mass may remain small and painless. However, over time they can increase in size and become heavily vascularized. Large masses may interfere with milking, movement, hygiene, and normal skin function. Secondary bacterial infection may also occur due to constant contamination and irritation. In advanced cases like this, surgical excision may become also the best treatment option. Before surgery, the animal is restrained properly to minimize movement and ensure safe handling. The affected region and surrounding skin are clipped widely to remove hair and improve visibility of the operative field. Wide preparation is important because large tumors often require extensive dissection. After shaving, the entire surgical site is cleaned repeatedly using antiseptic solution such as povidone iodine and surgical spirit. The skin preparation is performed carefully in concentric circular motion, moving from the center outward to reduce contamination risks. Maintaining antiseptic condition is extremely important because the surgical site is located close to the udder region where contamination risk is naturally higher. Next, local anesthesia is administered around the base of the tumor. Lidocaine infiltration is used to block pain sensation in the skin and surrounding tissue. Adequate time is allowed for complete anesthetic effect before beginning surgery. After confirming proper anesthesia, the surgery is started. Using a scalpel blade, a careful skin incision is made around the base of the giant tumor or wart. The skin is elevated gently using tissue forceps. Blunt and sharp dissection techniques are used alternatively to separate the mass from surrounding tissue. As the skin is separated gradually, the deeper tissue attachment become visible. The surrounding muscle and connective tissue are dissected carefully to avoid excessive tissue trauma. Proper dissection technique is very important because incomplete removal may lead to recurrence of the growth. One of the major challenges during giant tumor surgery is bleeding control. Large masses often contain numerous blood vessels supplying the abdominal tissue. During dissection, bleeding points are identified carefully. A cauterized machine is used to control hemorrhage effectively. Cauterization helps seal blood vessel quickly and maintain a clean surgical field. Good bleeding control improve visibility during surgery and reduce blood losses in the animal. After controlling of bleeding, the surgeon proceeds with deeper tissue dissection. Excess fat tissue surrounding the mass is removed carefully to improve visibility and facilitate proper closure later. Large fat deposit may interfere with wound healing if left excessively. Next, the root or base attachment of the wart is identified carefully. This step is extremely important because incomplete excision of the root may result in regrowth of the tumor. Using surgical scissor and scalpel blade, the root attachment is dissected gradually until the entire mass is completely separated from healthy tissue. Finally, the giant wart is removed successfully from the body. After removal of the tumor, a large cavity remained at the surgical site. The area is inspected carefully for bleeding, contamination, or remaining abnormal tissue. The wound is washed thoroughly using antiseptic solution, especially povidone, iodine, or eviodine solution. This step helps reduce bacterial contamination and lower the risk of post-operative infection. After cleaning, antibiotic powder is applied directly over the surgical wound to provide additional protection against bacterial infection. After proper cleaning and preparation, wound closure is started. The deeper tissue layer are sutured carefully to reduce dead space and improve healing. Absorbable suture material may be used for deeper tissue closure. Finally, the skin suture using interrupted sutures to provide strong wound apposition and allow drainage if needed. Uniform tension is maintained through the closure process to avoid tissue necrosis and wound dissection. Post-operative care is extremely important after giant tumor surgery. Broad-spectrum antibiotics are administered to prevent infection. Painkiller and anti-inflammatory medication help reduce pain and swelling. Daily wound dressing and antiseptic cleaning are necessary during recovery. Fly control is also very important because flies may contaminate the wound and delay healings. Large wound or tumor-like growth should never be ignored in cattle. Early treatment can prevent complications and make surgery easier and safer. For more real veterinary surgical tutorial, clinical case studies, and practical farm animal treatment videos, subscribe to Nova Vet Care and stay connected with us. After completing the surgery and suturing techniques, we used two types of suturing materials in this surgery, one type of absorbable suture materials and another of non-absorbable suture materials. In case of absorbable suture materials, the catgut or vicryl may be used whole surgical case. In case of non-absorbable suture materials, nylon or silk may be used worldwide. So in this case or in my surgeries, I used vicryl for muscle suture and nylon for skin suturing. And post-operating care and management is very important because all surgical procedures depend after post-operative care for quick recovery.